How are bladder symptoms diagnosed by healthcare providers? Have you ever wondered how healthcare providers figure out what's causing bladder symptoms? Bladder symptoms can signal a range of issues, from urinary tract infections to more serious conditions like bladder cancer. The diagnosis process is thorough and involves several steps to ensure accurate results. First, healthcare providers start with a detailed medical history. They will ask about your symptoms, previous surgeries, and any health conditions that could be related. Understanding your medical background helps them identify potential risk factors. Next, they assess your symptoms. Common bladder symptoms include frequent urination, urgency, painful urination, and blood in the urine. Describing the severity and nature of these symptoms is crucial for diagnosis. After the clinical evaluation, diagnostic tests come into play. One of the first tests is a urinalysis, where a urine sample is analyzed for signs of infection, blood, or other issues. If an infection is suspected, a urine culture may be performed to identify the specific bacteria, guiding appropriate treatment. Imaging studies are also important. Techniques like ultrasound, computed tomography scans, or magnetic resonance imaging can help visualize the bladder and urinary tract. These images can reveal structural abnormalities or tumors. Another test called Uroflowmetry measures the flow rate of urine. This helps assess bladder function and can indicate any obstructions that might be present. In some cases, healthcare providers may recommend specialized procedures. Cystoscopy involves inserting a flexible or rigid scope into the bladder. This allows direct visualization of the bladder's interior to check for abnormalities like tumors or stones. Cystometry is another procedure that measures the pressure inside the bladder, providing insights into its function and capacity. Urethrophy uses contrast dye to visualize the urethra and detect any issues. If bladder cancer is suspected, additional tests may be necessary. A biopsy, where tissue samples are taken during cystoscopy, can confirm the presence of cancer. Imaging tests like computed tomography scans or magnetic resonance imaging may also be used to stage the cancer. Treatment options depend on the underlying cause. For urinary tract infections, antibiotics are typically prescribed. In cases of bladder cancer, treatment may involve surgery, chemotherapy, or radiation therapy. Making lifestyle changes, such as reducing caffeine intake, can also help manage symptoms like frequent urination. In summary, diagnosing bladder symptoms is a comprehensive process. It includes clinical evaluations, diagnostic tests, and sometimes specialized procedures. Early diagnosis is essential for effective management and treatment of bladder-related conditions. Always consult a healthcare professional for personalized advice and treatment options.